what do you know about this X-ray?
In terms of just patient or
Just tell me about the X-ray. What's jumping out at you? Like just
these signs in that heart. Like
So,
backwards or something.
not batwing, because it's not starting at the hilum and radiating upwards.
Okay.
It's going down.
Okay.
Yeah, almost triangles like that.
Mhm.
So that's kind of more maybe lobar, but in terms of zones, 1, 2, 3, 4. So
Mhm.
right upper, right lower, left lower. Which one is the most opaque? Let's say.
Right. Well,
So right lower zone opacity.
Mhm.
But is the left sharp or not?
No.
Yeah. So thinking about the diaphragm,
Mhm.
is the diaphragm sharp or blurry?
Blurry.
So there's something water density above the diaphragm. And again, thinking on the left side, sharp or blurry?
Blurry.
And can we see diaphragm behind the heart? Not really.
Not really.
So loss of cardiophrenic angle, blurry costophrenic angles, lower zone opacity, right worse than left. Yeah.
Mhm.
Separate to that, we can think about volumes. First ribs there, 2, 3, 4, 5, 6, 7, 8, 9, 10, and 10. So volumes are okay. Blurring diaphragms, loss of angles, not drastically fluid overloaded. There's a tube in here, endotracheal tube, and so on.
Yep.
So on the CT from the same day, we have the endotracheal tube,
Mhm.
and we're coming down. This is the top of the right lung and the top of the left lung. Here's these weird little holes. Yeah, and there's smaller holes to some degree in here, so some kind of emphysema type changes. Yeah, the bullae. Yeah, that's literal holes. But other than that, the lung looks, you can see a little vascular blood vessels and stuff running through. That's the trachea, the endotracheal tube inside his trachea. So the trachea comes down. The lungs look reasonably similar on both sides. The lung comes to the inside of the rib cage, and that's important further down. There might be the slightest little gap between the lung and the rib there.
Mhm.
So maybe something in the pleural space, but tiny on this. Yeah? See
Okay.
that little
Yeah.
gap there that
Yeah,
not there?
it's not there. Yeah.
So again, endotracheal tube in the trachea. That's the end of the ETT. And then this is coming to the bifurcation, the carina or carina.
Mhm.
Now, when we look here, the lung does not touch the ribs, yeah, and it does there. So we have a few different densities here. So this is the anterior part, so kind of upper and into middle lobe, and then this is the oblique fissure here,
Mhm.
and then that is the lower lobe. So this would be the edge of the lung. So there is some slight consolidative process there and a small amount of pleural fluid. And then the left side looks okay. So you can see the difference between consolidated lung and pleural fluid.
Mhm.
Yeah,
Different color.
yeah, different shade of grey. You can see that there's some contrast in here, and there's blood vessels. Yeah, and sometimes you see the airways as well. Let's find air bronchograms, which are not very obvious, but that is lung that's consolidated. Yeah, that is fluid in the pleural space. Yeah, there's no blood vessels and stuff here. And there's a few other random holes and things here. And then on the other side, again, to a lesser degree, some opacity in the lung. You can see airways in the consolidated lung and some pleural fluid. Yeah. So on the CT, you can very much delineate the difference between gas, water in lung, and then water outside the lung, because you can see those differences in density. Here you can't. It's all just black and white pixels. So you just say, look, blurry costophrenic angles.
That's the way to tell an X-ray.
And yeah.
But you can't really.
No, you can kind of see maybe some vague air bronchograms in here, but you can see that they're more obvious on this. And there's lovely airways that are full of air running through, lung that's full of water in the lower parts of the lower zones, and then some small pleural fluid. Cool?